Hello everyone. This is the second lesson of First Aid, Emergencies and Strategies. In this lesson and next lesson, we will learn about situations requiring first aid for individuals with intellectual disabilities and basic interventions. These situations first aid for bleeding, sprains, dislocations, and fractures, for injuries, first aid in poisoning, first aid in case of a foreign body in the trachea, first aid in electrical shocks, and first aid in health problems, and first aid in disasters. First aid for bleeding. Bleeding is when blood leaves the body as a result of disruption of vascular integrity. Individuals with ID may experience internal or external bleeding due to accidents, exposure to cutting, piercing tools, bumps, etc., at home, at school, at work, or any environment. Bleeding can generally be classified under two headings: external bleeding, internal bleeding. External bleeding, the individual's condition is assessed on the site of bleeding is determined. If the bleeding is intense and extensive, call 112 for medical assistance. A tampon is applied to the bleeding area with a clean cloth to reduce blood pressure in the bleeding area. If necessary, pressure resistance on the wound area can be increased by wrapping a cloth. The bleeding area is raised above the level of the heart. If the bleeding is intense, the individual is given a shock position. Cover the individual and wait with him or until the paramedics arrive. Now we can watch a video on bleedings.
When bleeding is severe, it can be traumatic and distressing. If someone's bleeding isn't controlled quickly, they may develop a life-threatening condition called shock, and they may become unresponsive. Bleeding from the mouth or nose may affect their breathing. So try to ensure that the airway is kept clear. Obstructed airway can be a cause for a casualty to become unresponsive. If the casualty becomes unresponsive at any point, open the airway and check their breathing and prepare to treat an unresponsive casualty. To treat someone with a severe bleed, put gloves on if you have them, as this will help to protect you both from infection. If the wound is covered by clothing, remove or cut the clothes to uncover the wound. Is there an object in the wound? If there is, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, leave it in and apply pressure on either side of it to push the edges together. If there's no object in the wound, apply direct pressure on the wound with your fingers and use a sterile dressing or clean, non-fluffy pad to stop the bleeding. If you don't have a dressing, ask the casualty to apply direct pressure themselves to stop the bleeding. Jenny, can you apply some pressure for me, please? Brilliant, excellent, well done. Ask a helper to call 999 or 112 for emergency help. Or if you're on your own, use a mobile on speakerphone so you can keep treating the casualty. Tell the emergency services where the bleeding is coming from and the amount of bleeding. The casualty may develop shock. So help them to lie down on a blanket or rug if there's one to protect them from the cold. Raise and support their legs so they are above the level of their heart. Do not raise the leg if it is injured. Jenny, can I lay you down? Okay. Secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut off the circulation. Check the circulation by pressing a near bed or skin beyond the bandage for 5 seconds. Release the pressure. If the color does not return within 2 seconds, the bandage is too tight. If blood shows through the dressing, don't remove it. Just apply a second bandage on top. If blood shows through both dressings, remove them and apply a fresh bandage, ensuring there is direct pressure applied at the point of bleeding. Support the injured part with a sling or bandage, but check circulation every 10 minutes. Keep monitoring the casualty's level of response while waiting for help to arrive. So remember, when treating severe bleeding, wear gloves if available. Remove or cut away any clothing from around the wound. Check for objects in the wound, but don't remove them. Apply pressure on either side of the wound. If there's no object in the wound, use a dressing or pad and apply direct pressure to the wound. Call 999 or 112 for emergency help. Secure the dressing with a bandage. Treat the casualty for shock. Support the injured area. Keep checking their level of response while waiting for help. And that's how we treat someone with a severe bleed.
Internal bleeding is the individual's vital signs such as consciousness, respiration, and pulse are evaluated. The individual is given a shock position. The patient cannot be moved or repositioned. No solid or liquid food is given. Call emergency phone number for medical assistance. Cover the individual and wait with her until the paramedics arrive. Second, first aid in sprains, dislocations, and fractures. Sprain is the stretching or rupture of the joint ligaments as a result of excessive strain of the joints. Dislocation is the dislocation of the bones from the joints as a result of pressure or strain. And fracture, the disruption of the bone integrity as a result of hitting, falling, or impact. Sprains, dislocation, or fractures may occur in individuals with ID who engage in different physical activities in daily life. Limitation in movements, swelling, bruising, and deformities in the relevant body part may occur. First aid in the case of sprains, dislocations, and fractures contributes to the return of the individual to daily life in a shorter time by reducing pain, swelling, and bruising, preventing permanent damage to the vessels and nerves, reducing the risk of disability and death. First aid applications in sprains and dislocations. The sprained or dislocated joint is fixed with compressive bandage. Compression with ice is used to reduce swelling, bruising, and pain that may occur in the sprained or dislocated area. If possible, the sprained or dislocated joint is raised above the level of the heart. The sprained or dislocated joint should not be moved and should be fixed if necessary. And the nearest health facility should be consulted for detailed medical advice. First aid applications in fractures. First, body temperature, skin color, pulse, and respiration should be checked. Low body temperature, bruising of the skin color, irregular and weak pulse, or intermittent and rapid breathing should be considered as an important risk. No attempt should be made to replace the fracture. In the broken arm, accessories such as bracelets, watch rings, etc. should be removed as there may be edema and swelling. The patient's clothes should be not removed, especially when an open fracture is suspected. If it's necessary to remove it, it should be cut off. If there is an open wound with fracture, the wound should be covered with a clean cloth. The boundary of wound should be supported with gauze patch in a donut shape, and the wound area should be bandaged. In order to maintain tissue integrity in the fractured area, the fracture should be fixed by splinting the joint with a hard object, wood, cardboard, etc. After the protected area is fixed, it should be held above the heart level and taken to rest. The individual should be covered to maintain body temperature, and contact with the health institutions should be made to seek medical help. Now we can watch a video on fractures and dislocations.
Soft tissue injuries. If it's someone might have a soft tissue injury, what you want to do for them is you want them to rest the injury, you want to protect it as well. You want to apply a wrapped ice pack, some sort of comfortable support, and you want to elevate it. So what I would be doing is if Joe's hurt her ankle, I would be very careful how I was looking after it, and I would be doing a nice supportive bandage. You can use a tubic red ball or a more cohesive sticky bandage, which is sometimes easier to apply, and I will be applying that up like this, so nice and firm. I will be squeezing her nail bed and see if the colour comes back quickly to make sure that I haven't put it on too tight. And when I'm bandaging, I would bandage from here to here for an ankle. I would bandage from here to here for a wrist, from here to here for an elbow. So you wouldn't bandage right on top of the joint and just on the joint because you'll constrict it too much, and you'll have better support if you go either side. So I'd be bandaging that like that up to about here. I would then apply a wrapped ice pack on the injured area, and we would support it and elevate it on a nice cushion or something so it's properly supported along her leg. And if that injury isn't feeling better after, not that long, or if it gets worse, I will be taking her to hospital to get it x-rayed, because the only way to know for sure whether or not it is broken or not, and whether you are just dealing with a soft tissue injury, is to get it x-rayed.
The next situation, the first aid for injuries. Individuals with ID may experience accidents at home or at school due to lack of attention, falling, fatigue, objects or slippery floors, etc., by cutting or piercing tools, and may need first aid. Body temperature, pulse, and respiration should be checked in the first stage of sharp and piercing tool injuries. Then, the depth of the wound, bleeding status, whether there is an object inside, the depth of wound, the contour of the wound, lips are checked. If there is bleeding, it is stopped by pressing the wound with a clean cloth. If necessary, the bandage can be tied without tightening too much. If the injury is a simple injury, the wounded area is washed with soapy water and then rubbed with a clean cloth. If there is any object seen on the wound should be cleaned. If there is a piercing object embedded in the body in deep injuries, it is fixed to body with the help of bandage and gauze patch without removing the object because the risk of bleeding increases when it is removed. For first aid for injuries, she should be transferred to the nearest health institution as soon as possible. When transferring the individual to health institution by vehicle, she should be placed on her back with her legs bent. The individual is covered with a light blanket to keep the body temperature under control. The abdominal injuries, the individual should not be allowed to eat or drink anything. If there is an organ coming out of the body, no attempts should be made to put it back into the body. The injured area and the organ should be covered with gauze patches and help should be requested from the emergency line. Now we can watch a video for injuries.
If you think someone has had a head injury, there are 6 key things you may find. They may have become unresponsive, even for a short time. There may be a scalp wound. They may complain of dizziness or nausea. They may have memory loss of events at the time of the injury or before the injury occurred. They may complain of a headache. They may be confused. If you're worried about someone who has had a head injury, you should get medical advice. With someone who has had a severe head injury, you may find that they have had a severe blow to the head, unresponsiveness, or a deteriorating level of response, leakage of blood or watery fluid from the ear or nose, unequal pupil size. If a casualty has any of the signs of a severe head injury, seek emergency medical help. To treat someone with a minor head injury, sit them down and give them something cold to hold against the injury, like an ice pack or frozen vegetables wrapped in a cloth. Amy, can you just put the injury? Thank you so much. Assess the level of response using the AVPU scale. Ask yourself, A, is the casualty alert? Are the eyes open? Do they respond appropriately to commands? V, does the casualty respond to your voice? Can she answer simple questions? P, does the casualty only respond to pain if you pinch the earlobe? Do they open their eyes? U, are they unresponsive to any of the above? If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head while playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. Advise to seek medical advice if their condition gets worse, they're over 65, they've had previous brain surgery, they've taken anti-clotting medication, they've been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury.
First aid for injuries. Individuals with ID may experience accidents at home or at school due to lack of attention, falling, fatigue, objects or slippery floors, etc., by cutting or piercing tools, and may need first aid. Body temperature, pulse, and respiration should be checked in the first stage of sharp and piercing tool injuries. Then, the depth of the wound, bleeding status, whether there is an object inside, the depth of wound, the contour of the wound, lips are checked. If there is bleeding, it is stopped by pressing the wound with a clean cloth. If necessary, the bandage can be tied without tightening too much. If the injury is a simple injury, the wounded area is washed with soapy water and then rubbed with a clean cloth. If there is any object seen on the wound should be cleaned. If there is a piercing object embedded in the body in deep injuries, it is fixed to body with the help of bandage and gauze patch without removing the object, because the risk of bleeding increases when it is removed. For first aid for injuries, she should be transferred to the nearest health institution as soon as possible. When transferring the individual to health institution by vehicle, she should be placed on her back with her legs bent. The individual is covered with a light blanket to keep the body temperature under control. The abdominal injuries, the individual should not be allowed to eat or drink anything. If there is an organ coming out of the body, no attempts should be made to put it back into the body. The injured area and the organ should be covered with gauze patches, and help should be requested from the emergency line. Now, let's watch Now we can watch a video for injuries. First aid in poisoning. Poisoning is the disruption of the body's metabolic functioning as a result of poisonous or harmful substance entering the body. The effect of the poisonous substance on the person varies depending on the person's age, immune system, weight, allergy status, and the amount of the substance. Poisoning usually occurs through digestion and respiration. Due to limitations in cognitive functions, individuals with intellectual disabilities can ingest chemicals, poisonous drugs, spoiled food, medicines, and other substances that can cause poisoning through the mouth or respiratory tract. In case of poisoning, symptoms such as vomiting, nausea, dizziness, loss of consciousness, headache, diarrhea, cold sweating could be observed. The basic measures to prevent poisoning for intellectual disabilities, persons with intellectual disabilities. Medicines should be kept in a locked cupboard out of the reach of children. When giving medicines to children, don't use evocative expressions of encouragement such as candy or fruit juice. Children should have adult and parental supervision over the timing and duration of their medication. Children should be monitored to take the medicines in the amounts recommended by the doctor. Don't take your medicines in the presence of people with ID, as they may imitate you. Keep household cleaning chemicals out of the reach of children after use. Keep the chemicals you use at home in their original containers. Don't put them in bottles, pellets, etc., other than their original containers. Make sure that the lids of chemical and gaseous products are closed. Choose products with a safety device on the lid. Make sure that the flowers and plants you take into your home don't cause any poisoning. Wash raw vegetables and fruits with plenty of water before eating. Keep the food in a cool place. Consume within the consumption period. Don't consume spoiled food. Consider the presence of allergies and additional conditions in your child's diet. In homes with gas or coal stoves, don't go to sleep until the stove is completely extinguished. If there is a need for first aid in case of poisoning, evaluate the respiration, pulse, and body temperature of the poisoned person in the first stage. Then lay the person on his/her side and open his/her mouth. If he/she is unconscious, pull his/her tongue forward. If there is any object in the mouth, remove it. If the poisonous substance is in the mouth, have the person rinse his/her mouth. If the person has drunk a toxic substance such as bleach, don't induce vomiting. Induce vomiting only in case of drug poisoning. You can use salt water to induce vomiting. In case of drug poisoning, give the person milk to prevent absorption of the poison from the digestive system. In addition, if the poisoning is caused by spoiled food, induce vomiting if the food has not been eaten for a long time. Don't try to induce vomiting if the meal has been eaten for 2 hours more. In the first stage of respiratory poisoning, remove the victim from the environment and direct the individual to fresh air. Unbutton the collar or buttons of the dress for easier breathing. Learn the substance causing poisoning, the amount used, and the time of use. Then call the emergency health services and direct the patient to the nearest health institution. Now we can watch some videos on poisoning and basic interventions.
Hi, I'm Jamie for Survival. I'm here to tell you how to treat someone who has ingested or come in contact with poison. Poisoning can occur in the following ways: ingestion through the mouth, inhalation, fumes in the lungs, absorption through the skin, or injection, drugs, or venomous creatures. Signs and symptoms include abdominal pain, nausea, vomiting, or diarrhea, profuse sweating, unconsciousness, seizures, or breathing difficulties. First up, check your surroundings are safe, especially if toxic fumes are involved. You don't want to end up with 2 victims. If necessary, move the victim to a safer area. Check for consciousness. If unconscious, call 000 immediately. If unconscious and breathing normally, turn them onto their side, clear and open the airway. If unconscious and not breathing normally, begin CPR. Take note, if there's burns around the mouth, wipe the area clean before commencing. If the victim is conscious, call the Poisons Information Centre on 131 126 and follow their instructions. These are some helpful tips to help you effectively manage the situation. If the poison is ingested, get the victim to wash out their mouth and spit it out, and also wipe around their mouth with a damp cloth. If the poison is inhaled, move the victim to fresh air as soon as possible, as long as it's safe to do so. If the poison is absorbed, remove any of the contaminated clothing and wash the affected area under running water. Now, if the victim can do this themselves, it reduces the risk of contamination to you. If the poison is injected, identify the substance and call 000. Be aware of any sharps. Do take note of the time of incident and the type of poison. Don't give the victim anything to eat or drink unless you are told to do so by medical experts.
In this video, you will learn what to do if someone has food poisoning. The following symptoms may appear 1 to 24 hours after eating contaminated food: nausea and vomiting, abdominal pain, diarrhea, fever, and dehydration. Have the casualty lie down. Call a doctor and follow their advice. Do this as quickly as possible if the person is particularly vulnerable. For example, an elderly person, a child, or a pregnant woman. If the person vomits, it is advisable to keep the vomit to show the doctor, but do not force them to vomit. Also, keep samples of suspect food with a view to identifying the germs responsible. If the casualty asks for a drink, give them sips of water. In this video, you'll learn to administer first aid to a person who has swallowed a chemical product. Most cases of chemical poisoning involve drugs or cleaning products. Find out what type of toxic product has been ingested. Try to determine how much was ingested and when. If the casualty is having trouble breathing, sit them down or help them into a position that aids breathing. Call the emergency services, give them the information you have, and follow their instructions. Do not give the casualty anything to drink. Do not make them vomit, because the toxic product will burn the lining of their mouth and esophagus the second time on the way up. Give first aid according to the casualty's condition. If they lose consciousness but are still breathing, place them in the recovery position and monitor them until medical help arrives. If they stop breathing, start cardiopulmonary resuscitation, altering 30 chest compressions with 2 rescue breaths. If you don't know how to give mouth-to-mouth breathing, do chest compressions, only at a rate of 2 per second.
In this lesson, we studied on the first aid for bleeding, first aid in sprains, dislocations, and fractures, first aid for injuries, and first aid in poisoning. Next lesson, we will study on the next 4 first aid situations and strategies. Thank you for watching.